Welcome to Crime in Court. We are reading through the Delphi trial transcript, Indiana versus Richard Allen in the homicides of Abby Williams and Libby German, and we are on the state's case part 16, and this is the second part of Dr. Roland Kohr's testimony. He's the forensic pathologist who did the autopsies in this case. And we left off with them admitting a bunch of photographs, and now they're going to go through all of the photographs on the stand and describe. So it is going to be kind of graphic, so just graphic, uh, graphic warning, just so you know. And we're going to go through, or he is going to go through everything. I like him. He's a very matter of fact witness, and he will so it some of it seems very maybe unemotional, but he's just like matter of fact to the point. Like if I'm looking at a brain, I'm talking about a brain and whatever. He's just gonna tell it like it is. He's scientific and he's a doctor, so there's that. So let's continue on with Dr. Roland Kohr, the second part of his. We're still on direct, and let's get started. Please hit the like button. Let's talk about the photos related to Abby Williams. Is this a photograph taken after the sweatshirt was removed but before any cleaning of her body? Yes. And you can see the white material here in the body bag, which is a plastic vinyl type of material. We've taken off the sweatshirt. We've still left on the camisole and the sports bra still underneath that. We've obviously not cleaned away any type of blood residue, as you can see it on the arms. We can see it kind of obscuring what's going on here. We do see some pools and dried blood there. Sorry, when you touch the screen, yeah, this has happened with multiple witnesses now that people are trying to point on the screen and they touch it and then it changes the image on the screen. He says it reacts to that, and I apologize. He says, all right, okay. Also shows there's no types of injuries, obviously, here or anywhere on her forehead, and this looks more like a smear injury or a smear type of injury as opposed to a direct transfer like a bloody hand wiping that away. So this is more likely from clothing coming off, and that's one of the problems we get when we remove clothing that has to come off. Sleeves, if there's blood on the higher up and it's pulled off, it sometimes will transfer. Okay, in this photograph we have taken off the camisole. You can see there's a gray sports bra here and then a black brassiere underneath that as well. So she was wearing Libby's bra and her bra, I think. We still have not cleared away any type of blood residue, so it's kind of hard just to tell exactly where the wound is. Does have earrings in place, mouth partially open, and again, we have some transfer blood here on the arms and into the body bag area. Next photograph. Is this displaying the gray sports bra has been removed? Really, you need to show all these photos. You need to strip her down naked and show her to a jury after everything that the girls had to go through. Yes, again, we are kind of stepwise. We remove clothing, so now the gray sports bra is removed, showing us the black brassiere. This photograph of the measuring device, the ruler, is showing that. This is showing inches. I can tell that because the way the markings are, as opposed to centimeters, but we see the wound. We've got a very sharp demarcated end here. Over here, we have a slight abrasion, irregularities of the skin, and that tells me there's been some sort of blunt impact here, possibly as the weapon was drawn across it. We also see that the wound is gaping, and that's what I described earlier because the muscle fibers underneath the skin are going to be pulling it apart. So this is the wound as it's been cleaned to show the edges, but kind of misrepresents the total length of the wound in this dimension because of the fact that it's gaping in that way. Which side, just for clarification, which side is Abby Williams' side, right side of her body? I believe her right side is here. Really, you need to show her right side. And this would be her left side. And your opinion was that the injury you believe went right to left, although you said it was not, it's not definitive, but that's the more likely explanation because a weapon with a hilt or some blunt, a handle part, would more likely cause it on this side to if it's being drawn left to right, or excuse me, right to left, as opposed to being drawn this way where you have to have a blunt impact before the blunt impact which strikes the skin. How deep is this injury? The injury is only in the neighborhood of maybe an inch deep or so at most. Was there any damage besides the jugular veins that you noted, any injury to any other part of her anatomy? Well, you can see that there were some muscle fibers here and here that have been cut across and are called the strap muscles in the neck, which give your neck your ability to move in various positions. The fact that it's only a partial transection, not only the way through the vessel to damage anything underneath it would be very difficult to explain, because you'd have to cut the vessel, sneak around underneath it, and then cut things deeper to it. So basically, this comes across, went through muscle and part of the thickness or the diameter of the jugular, but didn't do any other significant damage. Obviously, cut through fat as well, though minor blood vessels, which are going to be here under the skin, commonly labeled, superficial incisions or whatever cause bleeding. You stretched that wound at some point and had it photographed. I did. And what was the purpose of that? Again, to show that the without this gaping in this orientation would do to reflect more accurately the actual length of the wound. And I believe that's our next photograph. Is that what you're doing here? That's what we're doing here. So these are my hands and my fingers pulling the wound about as taut as we could get it. Again, you can see the abraded edge here on the side and the slight discoloration. None of that on this side as we draw the wound. Pulling it this way, it allows it to kind of flatten out and be a better representation what the actual length of the incision is. On this photograph, we're looking at the top lip, and then below the bottom lip, and then just at or below the chin, would you describe to the jury what you observed in this photograph? Well, we can obviously see for reference where the mouth is, the front teeth. We see some very, very minor abrasions of the lips. We can see the wound down here on the neck that went from the left side to the right. We can see here parallel to this line. Sorry, parallel to here, you can see there's very, very faint reddish mark here and a sorry, very faint reddish mark here. So having one here, and those are roughly, I'd say, about 2 inches in width. So again, that would be possibly consistent with something like duct tape, although there's no residues, no glue residues like you'd see with duct tape. It could be also caused by a cloth or something else that's caused a very straight, very uniform line across there. The fact that those are below the mouth as opposed to above it, it would suggest that the mouth was not covered over by whatever this was. Photograph is showing the Abby Williams back. This just shows that obviously she has been exposed to various dirt on the floor of a wooded area where she was found. The purplish discoloration we see here and that we see here on the backs of the legs is something called livor mortis. That's LIVOR. It's a phenomenon of gravity causing blood to settle in the tissues underneath the skin. She was lying on her back for a long period of time, and that's going to settle to her back. Had she been found face down, we'd expect to see this on the front. That just kind of reiterates the fact that she's been laying in this on her back position for a prolonged period of time. You see that in certain areas like here and here, we have clear areas. That's caused by the folds of clothing that prevent blood from settling in those capillaries because of the pressure. You also see some sparing of where the buttocks were in contact in with a surface, as opposed to right above the thighs where the blood can settle. So we have pressure preventing the capillaries from dilating. You will not see liver. And then the areas adjacent to it, where the gravity is not impeded or displaced, you will see the liver. So, again, was on her back. We've got clothing indications where here, we've got clothing indications here and possibly here as well. So she was on her back for a prolonged period of time after death, and generally for this to become visible, it takes several hours for it to become fixated. Whereas if I push on it with my thumb in the morgue, it has to have been there for at least about 8 hours. This is simply her lower extremities, the same as you were describing. Is that correct? Yes, just for completeness. In terms of the examination of Libby's autopsy, just a few examinations before we proceed to the photo documentation. You indicated height and weight for Abby Williams. I'll put your notes closer to you, sir, for you to reference if you need to. Can you tell the jury the height and approximate weight of Libby German? Well, again, as I mentioned, I we measured length rather than height, so there may be some very slight differences there, but as I indicated earlier, 64 inches in length, 5'4", and I estimated at her weight at approximately 95 pounds. That was Abby Williams, is that correct? That was Abby Williams. And on Libby German. In the case of Libby German, also 64 inches, and the estimated weight was 200 pounds. Did you follow the same procedure that you outlined in which you do an autopsy and which you did Abby Williams' autopsy with Libby's? Yes, I did. And this is after Libby's body had been removed. The autopsy had been completed, the body removed. Is there a cleaning process that takes place between autopsies? Yeah. One of which, once I leave the room, the autopsy assistant proceeds to return the organs to a plastic bag, which is then placed back in the body cavities for burial. The incisions we make, the Y-shaped incision and scalp incision, are sutured shut by the autopsy assistant. The body is washed down of any extraneous blood materials that might be there, placed back in the body bag, and then returned to the body cooler for long-term preservation. Instruments are then cleaned, rinsed. The table is washed down so we should not have any residual blood of significance anywhere on the table. Once that's done, all the containers with various samples are labeled properly to make sure they're not cross-contaminated or mixed up samples. And all this is taking place while I'm back in my office working on my report. When I'm finished with my report and they finish with the cleaning and we break for a quick something to drink or whatever, and then we're ready to start the second case. Dr. Kohr, in your second autopsy, the autopsy of Libby, did you conduct the same Indiana assay collection kit process with Libby as you did with Abby? Yes, we did. Did you find any evidence in your examination of SA or trauma? Again, I saw nothing that was visible to my naked eye examination. Were there other swabs collected, items collected by the crime scene investigators, in addition to the Indiana State Police collection evidence kit? Not to my recollection. Basically, we just follow the protocols, which is go through the bags as they're labeled, one through whatever, and then those are packaged, sealed, and secured. If there was testimony that there was swabs of breasts or swabs of areas of Libby's body, could that have happened? It could have happened. There are, within the evidence collection kits, things for extra miscellaneous, and of course, those would then be labeled specifically of what the source was. I just don't recall things. It's been more than 7 years we did this autopsy. what, if anything else, may have been collected beyond the labeled ones for various sites, such as mouth, genitalia, etc.? But there are extra envelopes there for extraneous things that may be apparent or desirable to be collected by the state police based upon their information. Did you find any defensive wounds or wounds that could be related to physical restraint of the body of Libby German? I did not. She had how many incised wounds to her neck? I'd be certain of at least four different wounds to her neck, and I thought that there may also have been a fifth. Some of those overlap, but there's definitely at least four. And they are large wounds. Is that correct? Well, they are similar size and similar appearance as to what we see in Abby. So the one of the wounds, or two of the wounds, were they connected in any fashion or overlap in any fashion with each other? Yes, they are. And that's why we say, even though it looks like to the first glance that there's only three wounds, when we look at the wound edges closely, we can see that there is basically a point to either end. Essentially, what we have is a very collapsed sort of X sort of appearance, but we're able to see that there is different sizes, a different site of insertion or beginning of incised wounds or whatever weapon was used. We'll go to the first, blah, blah, blah. Start that over again. We'll go to the first photograph. This is prior to any cleaning of her body, correct? Correct. And on her hand, what did you observe there? Well, paper bags are frequently used in various police agencies at the scene to protect physical evidence under the nails or anything else that might be present. Paper is used rather than plastic because plastic retains moisture and you get condensation and then something something inaudible of evidence. Paper allows some breathability and keeps things dry as opposed to having again condensation and runoff that may contaminate things. And then those are sealed with tape. And then to take these off, we'd cut through the tape, pull the bags off, and then note the hands separately. So they bag the hands. They put paper bags over the hands. You may have heard of this before to keep any evidence remaining on the hands, and then they can, especially you don't want it coming off in transportation, so that's what they do. And then during the autopsy, bags are removed. And that would have been done before any cleaning? And that was done before any cleaning, yes. Okay. Because if we start cleaning, we risk getting the bags wet by water spraying or whatever, so we want to do this when they're still in kind of a dry, pristine state. Let's move to the next one. This shows the farthest right wound incomplete and in the middle wound. What can you tell us about this the right side wound on Libby? Okay, for reference, right down here we see the right earlobe. We know this is right side of her body. We see the wound here, and what we see here is this little pointy tag. That's why we can say there's two separate applications of whatever type weapon was used. And because that sticks out there, you know one had to go this way and one had to go that way, or whatever direction they were traveling. But that tag should not be there if it's just a single, passage of whatever instrument was used to cause the wound. So that suggests to you that that's two wounds there. It's two wounds. And again, they may have been just trying to make a deeper pass the second time, but it's not exactly on track. And the result, we've got just a slight deviation off to the side, so I can't tell whether this was from the first and this was second or vice versa, but there are two overlapping wounds here. We'll move on. But I want to note in this photograph and the portion of the right shoulder not far from the collarbone area, I guess, what is that? That is a very superficial, an extremely superficial type of probable incision. It really doesn't go through all the layers of the skin, so a very minor injury of really no significance. Something near her collarbone and shoulder area. Other than abrasions noted on her leg, did you notice any other injuries to Libby's body besides what's depicted on her neck and that injury to the right shoulder? Yeah, you've got a very tiny, minute abrasion here. Very minute one here. Maybe a millimeter in diameter, in dimension, if that much. Just below the neck? Yeah, right here. Okay. And then we've got a couple of very, again, very superficial types of probably more abrasions than incisions, but other than what we're seeing in this photograph, I saw no other significant injuries. Next photograph. This is that injury that you indicated the most, the portion of the injury closest to the right ear. Correct. Again, here's the right ear, and this was what we pointed to earlier, the one pointy part sticking out here on the opposite side. On the far right side, you can see there's a companion. So again, we've got one wound is kind of gone this way and the other that way. So we've got again a very narrow X-like pattern over here, but definitely this to get this and this, you'd have to have two passes or of whatever caused this wound. And I've used my forceps here just to kind of accentuate and show that this is definitely there. So it doesn't tract with the elasticity of the skin. Okay, move to the next slide. Now, this shows more to the center and the left side of her neck. Is that correct? Yes. This is the wound that's just been described with a little tag kind of out here, and then this is our next wound. And again, there's almost a suggestion of a tag coming out here, so that's why I can't be 100% certain that this wasn't a two pass as well, which would make it five. But I can't say with certainty since there's only a single point of separation here. We see in this area, obviously, hemorrhage. We see the fact that that's been cut across. We see bundles of muscle tissue which have been cut across. Again, there's a suggestion. This may be a second pass of the instrument here. Dr. Kohr, in your experience in conducting autopsies, have you done autopsies, many autopsies with stabbed and incised wounds? Yes, I have. Can you tell the jury anything about how the victim reaction to an attack can affect the nature of the wound? Well, assuming that the victim is conscious and able to mount some sort of defense, usually they don't just sit there passively while they're being attacked. So, if someone's trying to cut you or stab you, you're going to be moving your body, trying to get out of the way, and defensive posturing. But again, if you try to turn away and avoid, that could affect, especially if the blade has already been inserted or an incision made as you draw away, that may cause things to be accentuated or create artifacts. Now, one classic artifact you will see, and I don't have something really good here to demonstrate with, but I will take my two fingers. If this is a stab wound, if I go in this way and then my body jerks or the person that has stabbed me twists and then pulls it out, I make what looks like an L shape or right angled wound. It developed from a single wound as opposed to a going in once, going in a second time. So we can see artifacts like that because the body moving and pulling away and causing things to be extended. Again, it's very unusual for the body to remain perfectly upright. We see that also in the case of gunshot wounds, for example. Okay. People don't just stand there like this to be a target and will move and will change the inaudible. If our prosecutor here, Mr. Luttrell, is shooting at me, you would expect for them to go straight through front to back, but they may go left to right, maybe to right to left, depending upon what position my body's in at the time that the wound was being inflicted. Thank you, doctor. Next photograph. Now we're seeing more directly the left 2 and 3 wounds. This is the most prominent. This is the center of the 3 wounds. And again, this little tag here, again, it is really now strongly suggestive that this may be a double passage on this one. And now we're seeing the third wound, which is farthest to the left, this being the left here. And this shows the three large areas of incision, but they are four and possibly five incised wounds here. Correct. I want to focus on this portion. I don't want to go back, but I will very quickly to this area most right in the photograph, the injury. That's the area that being focused on in the next slide. Is that correct? Correct. And while the photograph loses some clarity in this position, did you examine in considering that those five marks there? What did you conclude about those? My initial impression was this resembled something like a serrated type of pattern, like you could see from a serrated knife, like we use in our kitchen that has the scalloped edges. There's one here, one here, one here, one here, whereas this one is a little bit different in nature. So I'm not sure this is the same type of injury. Now, let me just stop there. Basically, they've told us it's all like a box cutter. Here, he's saying a serrated knife was used, like a kitchen, like a serrated knife you find in your kitchen. And he's saying that's not consistent with the other injuries, which don't look like they came from a serrated knife. So that means then essentially two weapons were used. So why would Richard Allen be using two separate weapons if it was just Richard Allen by himself? Don't you think? Maybe two people might be involved if there are two separate weapons. It just kind of makes you think, doesn't it? Now, the problem, as I thought about this more and more as time has gone by and I studied the photographs, is a typical serrated knife will have the deepest part to touch the skin, would be kind of in the center, and we would then have clearing on the other side. Whereas on this side, we have almost two parallel lines here are reddish with a spared clear area in the center. And so that area of the more I've looked at this over the last several months in preparation for the trial, the more I considered this. Probably is not from a serrated blade. So now he's changing his opinion and saying it's not from a serrated blade. Probably. But from something else associated with the blade or a handle of a blade or the hilt. Just because the nature of is such that we don't have any single deeper portion through the center of base, but almost a sparing area here. So these are more like abrasions than a serrated scraping type weapon across. And so the distance between those two lines was that, as you consider it and look at that photograph, the distance between those two lines, is that part of your form, part of your opinion? Well, if we're talking about primarily the width of these marks. Each of these marks is about 1 millimeter, maybe a millimeter and a half in width, and they're separated by several millimeters between each one. So we've got a marked separation of normal skin, a marked separation of normal skin, a marked separation of normal skin, whereas this one doesn't have that central paler like we're seeing in this classic one in the middle. So that's why I'm thinking this may be something entirely unrelated from a different part of the weapon or from a different mechanism. So maybe not even the weapon at all, maybe something else entirely. In fact, you were deposed by Mr. Rosie and Mr. Baldwin back in February of 2024. Is that correct? Yes. And you had put in your report says a serrated edge? I'll object to leading. Mr. Luttrell says, I'll withdraw. Sustained. Says, I'll withdraw the question. What do you recall about do you know what your report stated in terms of a serrated edge? Specifically, my report used the word serrated edge, but that's on the face sheet. Later the court says, "Sir, you need to be by a microphone. We're not catching you. There's a microphone back here." The witness continues, "On my face sheet summary, I used the word serrated. In the later on, sorry, again, on the separate paragraph on page 3 of the autopsy report. Again, I use the word serrated, but as I recall from a deposition, when this was discussed in detail with Mr. Rosie, by that point, I was saying more it's not a typical serration, it's not a classic serration, but serrated like. And so that's, I guess, the clarification I made later on. Serrated like. So it's not serrated, it's serrated like. I'm sorry, what does that even mean? Don't even know. In your deposition, did you reference to Mr. Rosie and Mr. Baldwin that the 5 marks there, just above that wound, adjacent to that wound, could have been caused by something other than another part of that knife? I believe I did. And in your opinion, what part of the knife or sharp edged object could leave that type of mark? Well, most knives are not just a steel blade without anything around it because you got to have something of a handle so you don't cut yourself handling the device, especially sharp knives. Whether it be a steak knife or other kitchen knife, you can have wooden handles. The wooden handles can have marks on them in various patterns. They may have plastic or other types of hilts to prevent them from, or to prevent you from pushing it too far or having your hand slide down past the handle in a blade onto the blade itself. There can also be sometimes plastic like grips, depending upon the type of weapon. One of the things that I encountered as I was ruminating about this over the last several months was on my own workbench in my own garage. I happen to have a box cutter. Here comes the box cutter. Whoops. In his own garage. I think this should not be allowed. But one of the things that I encountered as I was ruminating about this over the last several months was that on my own workbench in my own garage, I happen to have a box cutter. And I've used this for various applications around the house. It just so happened the box cutter has on the side a plastic attachment, rubberized almost, that actually has several parallel lines for a thumb grip to keep you from having the thing slip out of your hand. And this somewhat resembles the size of the pattern that those thumb grips would be on a box cutter. And so, the more I thought about this, considered possible causes, I'm thinking that this may indeed be related to a box cutter side, but it could be something else similar attached to the actual blade. So there we have it. He believes it's a box cutter. Dr. Kohr, I'm going to ask you to return to your seat at this time and you may take your reports with you. Let's talk about the first. I want to go through the symptomatic or the physiological effect of these injuries. Let's talk about AW first. When this wound was received, what would have been symptomatic of or her body? How would it respond to this injury? Well, obviously, the first thing you're going to do is you're going to feel pain because of a sharp instrument being passed around across your skin, breaking through the skin and the deeper structures. Now, from a mental standpoint, I cannot predict. How is he talking about her mental standpoint? He shouldn't be. Objection, Your Honor. From a mental standpoint, I cannot predict how an individual is going to react mentally, but in an attack mode, they're going to, have some basic physiologic response, the fight or flight mechanism, which is called the autonomic response, like your fight or flight. Heart rate goes up, blood pressure is going to go up, breathing's going to become more rapid. Whether or not panic sets in depends on an individual. Immediately, because of this being a venous injury from your vein, rather than an arterial injury, we're going to start to have bleeding, and the bleeding is going to be not under pressure, but more of a passive blood flow. This is why I think this was some kind of ritualistic ceremonial bloodletting, because I feel like they knew where to cut, how to cut. I feel like maybe possibly somebody may have been hung upside down at one point because of the whole, how the Odin upside down in the tree. They might have done that to like drain their blood. I don't know. I don't know, but I do think that this was a blood ceremony, some kind of blood ritual, and they wanted the girl's blood. That's what I think. Especially now that we know it was a passive blood flow. They did this they cut her in a deliberate way to make it a slow flow, if that makes sense. Now, certainly, this is a large blood vessel. As I mentioned, they're going to be similar to the diameter of a pencil, so you're going to have blood flowing away. But it's going to take some time before you lose enough blood volume to then have some of the more late stage effects. As blood volume decreases over minutes, heart rate's going to try to compensate for the lack of blood volume. Blood pressure may start dropping gradually, and eventually, again, we're talking many minutes. As the blood volume is dropped significantly, then we're going to start having onset of shock. So this is taking several minutes, or many minutes at least, and at some point, the individual is going to go into a state of shock from losing blood. Now, shock is a physiological response to dropped blood pressure, heart rate changes, and so forth. Eventually, certain organs stop getting the amount of blood they need to maintain function. Your body automatically shifts blood away from less vital parts of the body to more vital parts. So it'll preferentially constrict the blood vessels in the intestines, for example, because they really don't need blood in this situation as much as the brain and the heart might. So the brain's going to continue getting the lion's share of the blood supply to the point where it drops enough, blood pressure drops enough, heart rate drops enough that you're going to lose consciousness. Once consciousness is lost, person's not dead immediately, but we're reaching a level of oxygen delivery of the brain where it cannot sustain normal function. So, once the function drops off, you become unconscious and eventually then you continue bleeding until the brain actually shuts down and death ensues. Sounds awful, but I'm glad, like, I like his descriptions, even though I don't like his whole, oh, it just occurred to me it was a box cutter, because I think he's working for the state in that manner, in that regard, to just say, oh, yeah, you need it to be a box cutter. I'll make it a box cutter for you in our testimony. But I think it is a little, what was I going to say? I don't remember. I lost my train of thought. Never mind. Um, okay, moving on. Dr. Kohr, in your opinion, can you give a range of time that it would have taken for Abby Williams to, once she received that injury, to be either unconscious or deceased? This is really a crude ballpark estimate because there's no way to be absolutely sure. If she's sitting still, doing nothing, it's going to take longer than if she's running around being active. And standing upright's going to cause less blood flowing from here as opposed to laying down just because of the effects of gravity. But we're probably talking to lose enough blood from this sort of injury, at least 5 to 10 minutes, maybe a little longer. So again, it's not going to be something sudden by any stretch. So 10 to 15 minutes potentially for the entire process to take place. If she were laying down, would that be a shorter time than of standing up? It should be, yes, just because the laying down is going to have a lot of blood backing up into the veins and flowing away. As opposed to being upright, blood's going to be more likely to pool in the legs if you're upright. Unconscious could occur sometime before that time range that you described today. Is that correct? Well, that's object to leading, sustained. It was a leading question, says Mr. Rosie. Mr. Luttrell says it was. I agree. The consciousness would, I'll withdraw the question. Would you, thank you. Mr. Rosie says thank you. In terms of the injuries to Libby, once those injuries had been received, do you have an opinion on the similar issue in terms of what would her body's reaction be in terms of how long would it be until death? That was a really long-winded way of asking the question. Well, the same sequence is occurring. We're having blood loss, which is going to cause the autonomic response, elevated blood pressure initially, elevated heart rate, increased breathing rate. But because we've hit three different vessels of considerable size in this case, blood loss is going to be more rapid. And as the blood loss is more rapid, we're going to be then proceeding to the stage of shock more rapidly. So, these things all are going to be accelerated just because we have three bleeding sources rather than one. The fact that we're dealing with arterial bleeders as well, those are under pressure, not passively flowing, and so bleeding's going to be even more rapid because of an arterial bleeder. The time when you conducted the autopsy, sir, did you observe on the hands? Did you observe any blood on the hands of Libby? I did. And is there a normal reaction by a victim to a neck wound? I can't say what's normal, but the instinctive reaction is going to be the fact that any type of thing that's bleeding, you're going to try to stop the bleeding by applying pressure. And so, whether you've cut your arm or you've cut the back of your hand, or like I cut my thumb yesterday doing yard work, I'm going to apply pressure. But again, if you got bleeding from your neck, you're going to try to stop the bleeding to the best degree you can. That's basic first aid, Cub Scouts, Boy Scouts, Girl Scouts. I'm sorry, but no. It's probably like your normal human reaction when you get a cut is to like put your hand to it. So, I don't think it's a basic first aid reaction. I think it's a basic you get cut, you put your hand to it to feel it. If you can't see it, you're not in a mirror, you can't see it, so you put your hand to it to feel it. You know what I'm saying? So it's not because you're a Girl Scout or a Boy Scout. But yeah, you're going to try to stop the bleeding. That would explain why she has as much blood on her hands as she does. And can that slow down an arterial bleed in the applying pressure to the neck? Can that affect the blood loss? Certainly. Do you have a range of time that you can give in terms of when you think death would have occurred with Libby? Again, we're talking 5 to 10 minutes as a crude estimate, maybe in her case, closer to 5 minutes, just because, again, we've got three vessels that are bleeding aggressively. I don't know how well she applied pressure, how well her, application was. It's one thing if I see a patient on the table in the emergency department and I can see where the bleeding's coming from to apply pressure directly to it. It's quite another thing if I'm bleeding from my own neck and I'm just blindly trying to grab where I think the bleeding might be. But again, 5 or 10 minutes is probably the best ballpark estimate I can give. So you found evidence of cerebral edema in the body of Libby German and not in Abby Williams. Is that correct? That's correct. And I don't want to go into great detail on that, but what can you summarize for the jury in terms of what that told you? Cerebral edema, so swelling in the brain. Well, cerebral edema literally means swelling of the brain, and there's a couple ways we can look at that at an autopsy, one of which is the weight of the brain, and normal adults should have a brain weight of no more than 1,500 grams. And so when we see some that are 16 or 1,700 grams, then that's kind of a very simple call. The other things are a little more subtle and they involve as the brain. And again, we've all seen pictures of kind of what a brain looks like. It's got the hills and valleys. As it swells, the valleys tend to get squished together and the hills get plumper. And because the brain is encased in a solid, bony structure, it's really got no place to go. So as it swells against the confines of the skull, the hills get flattened, the valleys get squished, and it has a little different appearance than a normal brain. Instead of having some more or less dead space around the brain, it gets all kind of squished together. Now, cerebral edema can be seen in a number of situations. It can be caused from closed head injuries, but it can also be caused by anything that reduces the amount of oxygen getting to the brain. So, if I have a drug overdose, if someone's strangling me slowly, if I've had something else that's caused blood loss, as the brain gets less and less oxygen, one of the few responses it does is it starts swelling, retaining fluid. And so, generally, that's an indication that there's been some survival or at least several minutes after the initial injury occurred. It's not something that happens instantaneously, but develops over several minutes. So, again, reiterating that Abby was alive, or I'm sorry, this is Libby, just double checking. Yes, Libby had the cerebral edema, not Abby. So this is Libby. He says both of them were alive for some time, for several minutes um, after the injuries occurred, due to them not being instantaneous lethality. So, Dr. Kaur, are you able to determine time of death? The time going back from the time of the autopsy that occurred on Wednesday, the 15th, at the first autopsy, 8 a.m. Can you, with any precision, determine time of death? Precision? No. Dr. Kaur, was the condition of Abby Williams and Libby German's body consistent with having died 41 hours prior to the autopsy? Yes, they were. I have no further questions, Your Honor. Court says, Mr. Rosie. Mr. Rosie says, thank you. And now we begin the cross-examination of Dr. Kaur. Mr. Rosie asks, or says, sorry, I keep doing that. Mr. Rosie says, nice to see you, Dr. Kaur. See you, sir. Okay. So you testified in the state of Indiana and the state of Illinois, and you said even virtually in Montana. Is that right? Yes, sir. And I think when we talked before, you told me that you testified about 98% of the time on behalf of the state of Indiana, right? Well, I wouldn't say when you throw in the Illinois counties, it's probably closer to 90%, maybe 10% in Illinois and elsewhere. You told me 98% when we talked. Well, here when I took your statement, right? That's quite possible. Yes. Okay. And just to make sure we'll all be clear, you and I and Mr. Baldwin and the prosecutor were sitting in this room here in the courtroom on February 27th, 2024, weren't we? I believe that was the date, yes. And on that date, basically, I conducted myself and Mr. Baldwin conducted an deposition. I should say, sorry about that, a deposition of you in that room, right? Correct. And in that room, there was a court reporter that was with us. Correct. And that court reporter administered an oath to you before we started that statement, right? Yes, sir. And you swore that you'd tell the truth and the whole truth and all that kind of stuff, right? Correct. And you've done those many times, haven't you? Yes, I have. Probably hundreds, I'm guessing. Yes. And you would agree that you were questioned for a couple of hours in general? Yes. And that at the end of questioning, one of the options you have is to review that report. Is that right? Correct. They get a chance to review their deposition, usually even after it's written, typed up, and everything. And you have an option of reviewing it, and if there are any changes that need to be made, you can make those changes, right? Correct. And then you can sign off on those changes. Correct. In this case, you chose to waive your ability to review that report. So he didn't even review it, which is odd. He just waived his option to review it. He says, the witness says, after talking to the court reporter and she assuring me that she thought she got the overwhelming majority of the medical terminology correct, I did waive that. Yes. How could you? Okay. You're a medical doctor and you're like, yeah, I'm just going to trust a court reporter and not make sure that the words that I said are actually the words I said. When whether she's an expert in medicine or not makes no difference. She's a human and can make mistakes. So he should have reviewed them anyways, but moving on. Now let's talk about Abby Williams first. You didn't reference any time of death on the autopsy report that you generated for Abby Williams. Is that right? That's correct. And you don't know when she died, do you? No, I don't. You told me at the autopsy, strike that. I'm going to keep doing that. At the deposition, you told me that you know that she died somewhere between the last time that she was seen alive and the time that she was discovered in the woodlot. Yes, that's an absolute. Yes. I mean, that's basic common sense. And that's about the best you can do. Well, we can do a little bit better than that, but that's our beginning parameters, yes. Well, you even said at one point 28 to 24 to so 24 to 48 hours before she was discovered, right? Correct. And do you agree with that? Generally speaking, death investigations from the standpoint of identifying time of death can be very different and really challenging. That's one of the biggest barriers we face in forensics, unlike what's portrayed on the various TV shows. And you saw some photographs of the crime scene either before or shortly after you did the autopsies in this case. I actually didn't see crime scene photos until earlier this year. Okay, but you saw them? Yes, I have. Before you took, we participated in the deposition, right? I believe so. Well, do you recall telling me that you really couldn't draw any substantive conclusions as to the time of death based on these photographs? Yes, I do. Talk about the autopsy report on Abby Williams. You told me during the deposition that you couldn't really say much about the type of instrument that was used to create the wounds on her, didn't you? Well, we obviously described it as a sharp force instrument or a sharp bladed instrument, but in terms of the exact type, whether it be knife versus scalpel versus whatever, I could not tell you specifically no. And in fact, you said that you couldn't say anything definitively. Correct. Basically, what you could say was that it had a sharp edge, right? Correct. So then where did the serrated edges and all that come from? And you couldn't draw, or the fact that he just now knows that suddenly he knows it's a box cutter after looking at a box cutter in his garage one day. And you couldn't draw any conclusions about the length of the instrument that was used. Correct. Which makes sense because it wasn't a very deep wound. So it would be difficult to conclude a length on that. And and you said specifically that a person could inflict these types of injuries with anything from a pocket knife to a kitchen knife. That's what you told me, didn't you? Correct. You didn't say anything about a box cutter, did you? Nope. You said short bladed instrument, long bladed instrument. Either one of those could have caused those types of injuries to Abby Williams. Correct. He's not even arguing. He's like, yeah, you caught me. Those are the things I said. Like, I can't even deny it. So, where'd this whole box cutter thing come out of? Nowhere from. And there was no way for you to make a determination about whether or not those injuries were caused by someone who was right handed or left handed, correct? And you said earlier, or he says, correct, sorry. And you said earlier, it was one of the last things you talked about, Abby Williams' injuries. It was an injury to her vein, right? Yes. And if I were being a student of your profession, I think you said that the blood is flowing towards the heart when it comes to the vein. Is that right? That's correct. So the pressure in that area of that vein, it is particular case is much less in this. I think he means in this particular case. So the pressure in that vein, the pressure in that area of that vein is much less. Yes. Whereas with the arteries, the blood is flowing from the heart away from the heart, and so the heart's pumping that away, right? That's correct. cause that pressure is greater. Right. So a layperson would draw the conclusion that because the pressure is less, you would just bleed slower. Reasonable. So that's why how we talked about the blood flow would be slow from that wound. Was that the lesson you gave us all earlier? That is, yes. And so we talked at the deposition about how long this might have taken for her to expire, right? Right. And you agree that death certainly would not happen instantaneously with Abby Williams. Correct. And you suggested that there would be a much slower pace of bleeding because of that level of pressure. Yes. This again goes to I really think someone knew what they were doing and that this was some kind of blood ritual. And that there could be several minutes before sufficient blood loss would result in unconsciousness, right? Right. Not necessarily death, but unconsciousness. Right. And you even said it could be anywhere from 4 to 6 to maybe 10 minutes. It's hard to say, is what you said, didn't you? Yes. And so it is do you agree that it's fair to conclude that she may have had an opportunity to react to these injuries before she became unconscious? Definitely. To run around, to make noise, fight back, all those kinds of things could have been going on. Correct. Her trachea was not damaged. Is that correct? That's correct, meaning she could have spoken, she could have made noise with her vocal cords. What happens that there was oh sorry, where did I get which what happens? Okay, so her trachea was not damaged, correct. Which means that there was no blood flow or airflow restricted to her, right? Right. So she could have spoken. There's no reason why she couldn't have talked. No reason at all. No. Could have cried. She could have screamed. Any of those things. Yes. Remember, this is supposedly happening right when this Brad Weber is coming home from work and which supposedly spooked Richard Allen. Um I say supposedly spooked him. He wasn't there, obviously, in my opinion. I believe he's 100% innocent, but supposedly, Richard Allen got spooked by this Brad Weber coming home on this access road near the end of the bridge there, Monon High Bridge. And so he, instead of SAing them, he prematurely took their lives, which he was going to do anyway, supposedly, according to the state. So, but he freaked out and took their lives without the opportunity to SA them. And then, but yet staged the scene and put sticks and things. So if he was scared, how did he have all this time to do that? Is another thing that makes no sense in their theory. So just remember that. And these girls, if it's happening at this time of day, which we know that we know from pretrial filings, motions, that there was geofence data that proves that there were many people out around that time of day, even in that area where the girls were found. They were not Richard Allen. The phones that were located in that area were not Richard Allen at that time. So just keep that in mind. So if Abby had the ability to still breathe and still scream and make noise and run around and potentially move, if she wasn't being restrained, keep that in mind. So she could have cried, could have screamed, any of those things. Yes. And so her ability to breathe basically had remained intact despite the gruesome nature of that injury. Correct. You said there was a mark on her neck. I could pull the photo up, but I'm not in charge of the technical stuff here right now. Do you agree that, well, strike that. I'm going to do it with another question. We talked about this mark that kind of went linearly, so straight across the bottom of her mouth. Oh, the marks. Do you recall possibly being having cloth or tape or something? He says yes, he recalls that. And that was certainly not restricting her, whatever caused that restricting her from breathing, right? No. But you think that that mark was created sometime around the time of her death, or that, which I think you said perimortem? Perimortem, yes. So P-E-R-I mortem, right? That's right. Did you draw any conclusion that somebody might have placed something over her mouth? Is that your opinion? It's a possibility. It could have been that. It could have been clothing tightly around there. It could have been any one of a number of different things. Speculation is involved in that. Right. True. Yes. Tried to collect evidence from her fingernails, or at least you did, right? We attempted. We weren't real successful because they were so short. There's really nothing to be able to get underneath them to, nonetheless, we scraped the base of the fingernails on each finger. Yes. But as far as you know, as you sit here today, nothing of real value was obtained. Not that I have been aware of. And there was no trauma to her sex organ, right? Correct. And as to whether or not she engaged in any kind of SA or sexual activity, I should say, it's not the same as SA, any kind of sexual activity leading up to her death, you don't have any opinion about that either, as you sit here, do you? I do not. There's no, there's certainly no proof that that did occur, right? Not that I'm aware of. And there were samples collected from various parts of her body, in addition to what I think you said maybe that there was law enforcement was doing the same thing, taking samples, right? We work in tandem. When we get the body to the morgue, I'm the one actually plucking the samples for the most part and handing them off to them to package and label. Well, let's talk about Libby's autopsy report, okay? You said there were four, maybe five injuries. You were having a hard time counting because of some of the physical circumstances, right? Correct. And again, some kind of the same questions as before. You can't tell whether or not those injuries were inflicted by somebody that was right handed or left handed, right? That's right. A lot of issues involved with that, angles, and if someone's standing behind somebody versus in front of them, those kinds of things, right? Well, there's forehand versus backhand. There's, from behind, same things sort of go on. So, yeah, there's really no way to tell. Okay. And you told me that the one of the differences in the wounds that you saw or the injuries to Libby was that there were those serrated marks that you just spoke at about in some length, right? Yeah. You told me. Mhm. You used you shaking your head, yes? Yes. And you used that word twice in your autopsy report, right? Right. On the first page, which is the cover sheet that contains all the conclusions. Yes. And then on page 3 at the top, this is the 9 centimeter in length and shows the area of serrations along the medial and lower edge of the wound. So that's the second reference you made earlier. So that was a quote. Sorry, I should have said that. So he quoted or mentioned a serrated knife or serrations twice in the report. He says correct. So that was one of 3 or 4 or 5 wounds that you noted. Yes. Do you agree with me? Strike that. Did you tell me that that serrated area could have been caused by the handle of an instrument? I believe so. And did you tell me that it was possible that 2 different instruments could have been used to create those wounds on Libby? I believe I said possibly 2, maybe 3, possibly 4. So 4 possible different blades, which to me makes it even more like it's a religious, I can't speak, religious or ritualistic type of ceremony with multiple people involved, because that could mean multiple people were slashing at Abby's throat with three, possibly four different weapons. And it really makes it hard for me to believe that Richard Allen, first of all, I don't think he's even involved. Second of all, if he was, I don't believe that this is a solo assailant type of crime. I do believe that that makes it much more plausible. Just alone, the two different types of instruments makes it plausible that there are two assailants, let alone three or four. So, just pointing that out. And in fact, there's only one of those wounds where there are only, or where there are any of the serrated marks. So, only one of the wounds has serrated marks. That's right. And you don't see any of those on any of the other wounds? Correct. And the same is true with regard to Abby Williams' wound. Correct. So that might be suggestive that there might have been more than one instrument. That, or it could have been affected by the angle or insertion. Or the force of it, right? Correct. Which also could mean there are two people using different forces. But it might also be suggestive that there might have been more than one instrument. That's a possibility. More than two? Correct. We talked about cerebral edema. Yes. And we discussed that that was the mild, or that that was the swelling of the brain, I think is what you told the jury earlier, right? Yes. And that's significant here because it helps you determine whether or not there was any oxygen flow that was cut off to the brain while the process was occurring in general, right? Yes. So, in other words, if there's more swelling to the brain, that means there was less oxygen. Somebody was either being, asphyxiated, or they were just weren't able to breathe for whatever reason, right? And that, plus the fact that there's a time element, it takes obviously a certain time for the cerebral edema to accumulate. It's not like an off and on, or it's not like an on and off, whatever. Okay. But in Libby's case, the edema was mild. You noted it was mild. Is that correct? Yes. And that would also suggest that death was not instantaneous for her. Definitely. So we know both girls, they did not die instantly. And we talked, you said she had at least a few minutes before, from the initial injury before her death, right? Right. And you told me specifically when we got into talking about real times, it could be 3 minutes, it could be 10 minutes, even up to 20 minutes, didn't you? Yes. We talked about the fact that that injury, because it was to an artery, could have been caused for the projection of blood around the area where she died, right? Yes. And I believe we even got into some details about how far that could have been. I believe so. Maybe 6 feet or so? Uh, it can be that way, yes. So you've seen some examples of that actually have happened. I have. You noted some debris on her leg. Yes. And you suggested that maybe she was drugged from another location that would be indicative of that, the way that debris looked on her. Based upon the appearances, yes. So he also believes that her body was moved, or dragged, rather. There's nothing contained in either one of your reports that would help you draw any conclusions as to who is responsible for the death of the two girls, right? No, there's not. So all of the things he's saying, and like he's a good witness. I really like this witness. There's nothing except for the whole, oh, suddenly it just came to me that it was a box cutter all of a sudden. But besides that, he's actually a really good witness for the defense. He's not saying anything. I mean, he's a good witness for both. He's not saying anything for the state that's, putting the blame directly on Richard Allen. He's not pinning it on the defendant necessarily. He's just saying this is the stuff that I did, this is the examination I did, this is my report, and I'm reporting it back. He's very matter of fact, honest, to the point, maybe except for that whole box cutter thing, but I find him genuine and likable. So I really do feel like he's a good witness for both, actually, the state and the defense. And like, I think this is an important question that anything that he said so far, nothing really points to Alan, does it? He says no. It does. There's nothing that I've talked about that points to who's responsible. Now, earlier the prosecutor asked you, Mr. Luttrell, was asking you some questions about these serrated injuries. Is that right? Yes. Actually, we'll leave that there for 1 second. I've noticed in the images that were offered up that the girls, I think both girls, correct me if I'm wrong, were laying on a white sheet. Did you see that? Yes. I've seen a few of these pictures in my day. Is it unusual was that how they were delivered to you, as wrapped in a white sheet? Well, sometimes there's a white sheet inside the body bag just to, keep blood from flowing out. It's gonna more than likely retain it so it doesn't get through the zippered ends. But yeah, that. It doesn't get through the zippered. I don't know what that means. Does this happen in all occasions? Not every single occasion. It depends upon the county, what their budget is, who collects the body, how they preserve them, but it's not uncommon, but it's not universal. Do these sheets get reused sometimes? They can be. What? How can you reuse sheets if you're supposed to be preserving DNA and other forensic and biological materials? How can you reuse these sheets? Wouldn't that contaminate your whatever it is that you're wrapping in the sheet? Wouldn't it contaminate? I, I'm floored right now. And he says yes, they can be reused. So how do you sterilize them? Can you even sterilize them enough to the point where you get DNA and everything virtually gone? I don't know. Is there always a concern when that's the case that there could be some contamination because those sheets have been used for somebody else's body? So they are always used for bodies, apparently, reused. Well, generally, the sheets that are used in situations like that come from a hospital ambulance. And the ambulance gets their sheet supplies from the hospitals, which go through a sterilization process, for disinfection at a little bit higher level than the average washer dryer at home. But it still won't get everything off. I guarantee they're not completely sterilized. But, anyways, he says, in this case, do you know if those sheets came from an ambulance? I do not know for certain, no. Do you have any idea where those sheets came from? Well, generally, scenes like this are removed from the scene, or bodies at a scene out there are removed by medics or fire department personnel do the actual physical lifting and carrying. So it would usually come off of an ambulance or a, fire department vehicle. But again, that's what's usually done. And I have no way of knowing for sure what was done in this case. You don't know where the sheets came from? I do not. Talk about chain of custody. Shouldn't you know where the body bags and the sheets and anything that's going to go in that body bag, including the sheets, where those all came from? They should be. I mean, you already. It's not like you're responding to a medical emergency. You already know they're dead, so you already know you're investigating a crime scene. So you already know you should have a chain of custody in place there. So let's talk about these serrated marks again. After I took your deposition in February 27th, you apparently went back to Terre Haute and started thinking some more about these conversations that we had, right? Yes. He's just like, yeah, sure. I admit it. Absolutely, I did. And it sounds as if you were a little unsettled in your mind about what might have caused those serrated marks. Well, as we discussed in the deposition, and as I considered it, the fact that I think I said multiple times in the deposition, these were certainly not classic serrations. They looked different, and was just kind of the best match I could think of at the time of the autopsy. But it's not unusual for me after we do a case, after, speaking with various people. The more I consider cases I'm preparing to come to trial and have to answer questions from prosecution or defense attorneys, and I try to consider things that may help clarify. And again, I was settled with trying to call these classic serrations because they're not classic serrations. He was unsettled, sorry, he was unsettled with calling them classic serrations because they're not classic. So at that point, I consider, okay, what else might explain what these marks are? And so you mentioned serrations in the depo, that they weren't classic, right? Correct. But you didn't take an opinion about what type of an instrument was used when we took your statement back there, did you? No. And when you left this courthouse in February, did you ever contact my office again with any information, new information regarding your opinions in this case? I did not. So he went back after their depot, had these thoughts about, oh, it's a box cutter, but never updated the defense about it. Did you prepare any new reports that suggested, hey, I've changed my mind about what I said back in February under oath? I have not. Would that have been a reasonable thing to do with something this important? Well, if I made a definitive call the first time, then it would have been appropriate. The fact that I'm saying that these are possible explanations is not quite at the same level, so it's not routinely that I would do such, no. Did you talk to the prosecutor between February and now? I have. How many times? I believe 3 separate occasions. On any of those occasions, was it suggested that maybe you should prepare a supplemental report? No. So even the the prosecution was like, "No, don't tell the defense." So you don't have any way of knowing whether or not that instrument, that injury was caused by a box cutter, do you? Nothing definitive, no. And there are a lot of different kinds of box cutters, aren't there? I've got 2 different types in my garage. Well, how many times have you testified in your life, if you could just estimate? Combination of depositions and actually in court, probably 200, 250. And how many times do you think you've walked into court? Strike that. How many times do you think you've changed your mind between the time that you took a deposition, a sworn statement, and the time that you walked into a courtroom? Probably 10% of the time, just because of new information coming to me. And in any of those past circumstances, did you ever think, hey, I should prepare a report because I've dealt with this before and the lawyer's probably going to question me about this? There was one occasion because I was kind of set up by the prosecutor in that case and it became necessary, unfortunately. This case has got a lot of notoriety, hasn't it? It does. So much so that you even met with a reporter at one point a couple years back, didn't you? Yes. Sat and had coffee with that reporter? Correct. Who did he have no, who did he have a conversation with? I don't remember. I kind of remember this vaguely off the top of my head. I can't, there's so much in this case, I can't remember all the facts, but I do kind of remember this happening. But I can't remember who reported on it. I know the forensic pathologist and Kathy Mabbitt, or is that Idaho 4 now? Now I'm confusing my cases. Never mind, Heather. Just be quiet. Keep reading. So he's like, you sat and had coffee with that reporter. Correct. So you knew the significance of this case in terms of the attention it was getting from the public? Yes. You think it would have been a good idea to generate a supplemental report so that the defense would have had an idea that you were going to come here and change your statement today? Well, a supplemental report would have been considered speculative ideas as opposed to a definitive changing of statements that are on the report. So, generally, if I'm going to do a report, it's going to be something that I've got definitive evidence to support as opposed to speculation. Do you think it would have been a good idea? It might have been, but I can't say with assurance no. Either way, it's all speculation, right? Correct. Mr. Rosie says, pass the witness. Mr. Luttrell, says the court, and Mr. Luttrell says, thank you, Your Honor. And we begin redirect of this forensic pathologist, Dr. Roland Kohr. All right, so Mr. Luttrell asks, what's the minimum number of knives that would have been needed to cause the at least 5 wounds between the body of Abby Williams and the body of Libby German? Minimum number is one, but that's contradicts what he thinks. What he said he thought that there were at least two. So now he's saying minimum is one. That makes no sense. Well, did you note on your report whether or not the bodies were received in a body bag or not? Would note that on my worksheets. In the case of Libby German, she was received in a body bag. In the case of Abby Williams, she was also received in a body bag. With the fact that there's an artifact, if that's an appropriate term, next to that one wound, the wound that's farthest to the left of Libby German, would that by itself indicate that there probably was more than one instrument? Not necessarily, no. Mr. Luttrell says, thank you, I have nothing further. Mr. Rosie, says the court, and the court, or Mr. Rosie does have some recross examination here. You don't know how many instruments were used, do you? I do not. Nothing further. Court says, all right, does anybody on the jury have any questions for the doctor? No response or indication from any of the jurors. So no questions there. The court says, all right, thank you, doctor. You may step down. All right, well, ladies and gentlemen, we're going to go ahead and take our lunch break. While you're outside of the courtroom, please keep your minds open. Please don't form any opinions or conclusions about anything. You may discuss the evidence that you've heard. This is so highly unheard of. But please only do that if all 16 of you are present in the jury room at the same time, and then please don't deliberate. Gentlemen, the bailiff says, all rise. The jury exits the courtroom. The court says, all right, let's resume at 2 o'clock, please. Jody, you can go off the record. And they do. And we will stop right there and continue right where we left off with our next witness, who is First Sergeant Cecil. So First Sergeant Cecil will be, who is he? I can't remember now off the top of my head. I think he is Indiana State Police as well. Yeah, Indiana State Police, First Sergeant, Law Enforcement, Indiana Internet Crimes Against Children Task Force. That's where he's with. So we will hear from him in the next episode. So thank you guys so much for watching. I really appreciate you for following this crazy journey with me. I just think that this case needs so many more eyes, especially since Judge Gull tried to keep it out of the public, and I think more and more and more of us need to see what's actually happening in the courtrooms and why they're trying to keep things secret from us. So let's continue on. Tomorrow, I will see you here, same time, same place, and thank you guys again. Bye now.